I think people do want the dramatic change, but I think my job as their doctor is to advise them that if you go for subtle changes, that's actually novelty. That's going to make you look, more aesthetically sound and more, beautiful over the period of time. Educate them that, you will still look yourself, but you will just look better. Like you will transform better if you do subtle changes and do it over a period of time. And what I've realized is that patients really value your suggestion and they will really go for what you advise them. It's just about giving that extra time, sitting with them, explaining them, and they're actually really, really happy to listen. At least my patients are. So,
Yes.
I think it's the way you put it forward and how honestly you put it forward. And I think they're really there. I think patients do a really fab job.
Today's guest is someone who doesn't just treat skin. She studies it, respects it, and understands the person behind it. She's a celebrity dermatologist, a trichologist, the Dermatologist of the Year 2023, and the medical director of the Bombay Skin Clinic. But what truly stands out most is her philosophy: less is more. In a world obsessed with filters and perfection, she brings honesty, minimalism, and science back into skincare. Dr. Batul, welcome to Success Decoded. Welcome back to Success Decoded. I am so excited for today's conversation. We are talking about one of my favorite topics besides emotional intelligence, and we're going to weave that in anyway, which is skincare. And we are talking to the expert of Mumbai and beyond on skincare, hair care, and beyond that, right, today? So, Dr. Batul, welcome to the program. We're so happy to have you here. I am so excited about our conversation. I can't wait to learn more about you, what you've done, and the tips that you can give us about the emotional part of what you do. So, welcome to Success Decoded.
Thank you so much. It's been so exciting, and I'm so excited to actually do this whole session with you, and so much to learn from you too. And I think skincare and emotionality is so interlinked. It's linked to in a ways where I've been like really trying to tell people out there that when you have a beautiful skin, it can just really increase your confidence, which can help your emotional stability to such an extent. And even just not only that, but of course linked to gut, linked to stress, full nutritional part. So great to be here.
If you had to name one elegant virtue, so I'll explain what that is. So, an elegant virtue is what I always ask my guests. It's like, for example, honesty, discipline, respect, trust, love, kindness, whatever it is. It's this quiet quality that you feel has guided you since childhood and still shapes the doctor that you are today. What would that quality be?
So I think that one silent quality that I think I really have is my refusal to give up. It's I really know what are my weaknesses. I work on my weaknesses. I still know that I have to do few things more harder than someone else, but I'm ready to never give up. So I think that silent power of mine is to never give up and to keep working hard, and that's what my journey has been in the last 12 to 15 years of my clinic, where it is about being focused and keep working.
Yeah, amazing. And so basically, it's this emotional part is the resilience part of you that you will never give up, which is fantastic, which is everything we want and we want to learn more about on this program. So tell me honestly, were you the classic nerd in school, always top in the class girl, or were you someone who figured out medicine much later? And did you know you always wanted to be a doctor?
So this is actually really close to my heart. I was never the top of the class. I was not just that someone who would be taking medicine. I mean, I think nobody really thought that. I wasn't the most nerdiest, but I was definitely the most hardworking one. I would definitely work on my subjects fast more to get the best results. And medicine came to me actually by chance, and actually it was a journey or a process, because in school I was bullied, and I think that journey made me believe in two things. One, to show up for yourself. Second, I wanted to do something which was so respectful and something that nobody could ever, you know, um, make me feel less respectful. And that's how this journey of becoming a doctor came to me. And then, yes. And then it started to transcend into becoming something where I could help others to actually feel the same, that, make them feel happy, confident, good in their skin, etc.
Yeah, so exactly what you were talking about is you empowered yourself through education, right? Education is something where, especially we were talking about the women element of it, is that something nobody can ever take away from you is your education. Nobody will ever be able to take that away from you. So we always employ, and especially on this program, we employ everybody watching to go out and to study and learn something, whatever that is. Even if you think it's not, I mean, like you said, you never thought medicine, right? But you are always going to work hard and to focus and to learn and to grow and do your best, right? That's the mindset of it. Go out there and try to always learn and grow, because that's something that no one can ever take away from you. And as a result, now you're empowering other women through what you learned and what you're doing and your passion to feel better about themselves, which is huge.
Like in my own workplace, I have like 40 plus women working for me, and I think the biggest message I send to them is never stop learning and teaching. I
Yes.
think
Yeah,
that's
absolutely. Never
really
stop
important.
learning. Yeah, because there's always something we can learn, right?
Definitely.
Even within our profession or just in life in
In
general,
life in
right?
general.
So, growing up, what was the vibe at home? Was it a very academic household or did you own your own drive?
So the drive at home was filled with a lot of warmth, but some values. Like education was really important, integrity was really important. If I had to get to do something, then I had to finish it. Like I was told to finish it, and also like if you put your mind to it, then there were people to support me, to help me, to like really make sure that I do my best. So it was a mix of both, a lot of emotional love but also a lot of discipline. So that was my journey. And also was lucky enough to explore so many things, that not only education, but I was good at playing some sport like throw ball, tennis, ballet, music. So I did a mix of everything, and so it was a very happy journey in that way.
Why do you think you were so involved in so many different things? Was it curiosity? Was it that you wanted to spend some time to do something? Was it because it was encouraged? Or was it a combination of all of them?
I think I used to love to do everything which had a lot of energy, meeting new people, fun part. So I think it was like a both. So all these things, all the sports, and I think music and dance was something that helped me actually to what I am today. Like I have a very happy social life, and so I'm more social to my patients. Like I'm always this very energetic doctor which they love. So I think that all has helped me to be where I am today.
Amazing. So I'm sure you create I mean, I know the clinics have a wonderful environment in them, but I'm sure this contributes very positively to the environment they're having, because also you're empowering your staff and your teams to do the same, right? And you to have that same mindset and that same attitude, and which is huge. And also, and you did bring up a big point. So for all people watching, one of the Success Decoded is that you're learning even when you're not in a classroom, right? Or you're learning even when you're not studying those degrees. You're taking everything in and you're learning that and helping that develop part of who you are, which is basically what you've done. So that's fantastic. Okay, if you think of your childhood self, your personality, your dreams, what was one thing about yourself then that still shows up in your life today?
So when I was child, I was always organizing. Like I would organize my books, my library, my clothes, and I would always do things, too many things, but do it really well and plan it well. So I was always multitasking. So in my life today also, I'm multitasking fully but completely. So in my whole day, I can multitask on working on my clinic. I'm doing, if I have to see some complex cases, but also I'm thinking of a broader vision. What is the next thing I want to get to my clinic? What's the next technology I want to bring? So there are almost many things going on, but they're complete and planned. So I think I'm like this planned multitasker. Like
Yeah.
I will make sure that it's planned.
Right. And you develop those tools since childhood to be
Since
able to
child.
do this. Yeah,
Yes.
amazing. So you probably get a lot of energy from that as well, I would think.
I think I just feed on it. I just need energy and I give back energy.
Yeah, absolutely. You can feel that
I
totally. I wish
do.
you all could feel that, but you definitely feel that. Okay, if the younger version of yourself saw your life right now, the clinics, the patients, the awards, what do you think she'd be most proud of?
So I think my younger version would be proud of two things. One, I did dream of having this big clinic, a brand, and more so like having a list of patients where I have like a day filled with so many patients. I think that was my vision, which has been true. But the most important part is that I didn't lose my identity. Like, I'm still really bubbly, I'm still really social, I'm still very warm towards my patients, I'm still like there listening to them, and I'm still very grounded. So I think the mix of both, I think my the little self would be very proud
Yeah, of course you would be. And the
of.
holistic being,
And
right?
the
It's
holistic.
fantastic. Okay, so let's go from your younger version of you to the moment that dermatology really became your path. And I'm fascinated by dermatology, so we're so excited that we're going to have this conversation. So, dermatology may not have been the most obvious or popular field back then. Now, I think it definitely is, but maybe not back then when you were at least going through your medical studies. What first pulled you into this world?
So I think back then dermatology wasn't so, luxurious, or it was more like a very very seeing very complex cases of, rash or acne, very simple. When I started seeing more and more patients of acne, pigmentation, hair fall, then I realized that it is impacting. I'm not only treating skin, I'm impacting patients' life, and that changed for me. So I feel like dermatology is like it has threes: medical, psychology, and aesthetics. So it's a complex thing, and that really made me realize that I really want to, I do love dermatology and I want to take it to the next level. So that's when I started integrating a lot of wellness and programs in my clinic, not only just treating the skin, but treating the thing as a whole.
Okay, so will you tell us a little bit about some of these wellness programs that you've started in your clinic?
So, like for acne, we run this really very, very popular acne freedom program where, it's not only about treating acne, but it's about, explaining the younger generation, the Gen Zs, the Gen Alphas, about how they're supposed to eat well, the nutrition, the sleep. We also target a lot on helping them to treat their acne, acne marks, the active acne. So it's a very intense program, and also teach them how to use the correct creams. Then I have something called as a pigmentation freedom program, where I've helped treat a lot of patients with a lot of pigmentation and melasma. Then we have a body sculpting program. So these kind of programs have really helped, patients to have a vision that, okay, they're going to get better in 3 months, 6 months, rather than to be aimlessly doing treatments, is what I'm not a very big fan of. I have something which is like everything is very meticulously organized.
And also, it seems like you have from beginning to end. So it's not like you just, which is wonderful because in today's day and age, we have so much information coming at us from everywhere. I think that's probably one of the hardest things about this. For example, even just mastering like which skin product I'm supposed to use, when even that level of it. I'm not even talking about having melasma or anything else or acne, just basic skincare. It's complicated as it is. If you have somebody coming in with something that's a little more difficult or challenging or could really affect their self-esteem or whatever it is, to handhold them through the whole process, not only give them the treatment but give them the education, make them feel empowered on what they're doing, which is fantastic. That's fantastic. I actually, hearing about the melasma treatment, I actually know several people who would be really interested in that for sure, so we'll talk about that after the podcast. Okay, so what were the early days like of the learning curve, the doubts, the wow, the special moments, the beginning of your practice?
So early moments were really very, overwhelming. I was not sure where I was headed. I was trying to put my things into place. Then I realized that skin, hair, body is like a whole total. There's nothing that I have to treat a pimple as a pimple or a patch as a patch. Everything is so interlinked. Like skin is like a largest organ of the body. So I have to treat it fully, holistically. So I started off very early in my clinic, always as a holistic program, not just treat one thing, but treat it as a whole. So in our clinic, it's really important to diagnose the condition, to educate the patients. So that has been like a journey for me. And the wow moments are when we actually, started getting out there, and, I had patients, telling other patients that if you want a holistic program, then you need to go to her to really get the best out of your problem. So I think those were like those wow moments that I went through, that, maybe I'm headed in the right direction. And then early on, many years back, I don't think so sculpting or body sculpting, or, was not so popular, and I was someone who was really very empowered by it. So those kind of educational videos, which I, would love to send out to my patients, or when they would come into the clinic, I think that was really very, those wow moments were really great. And the next ones are longevity. Like, I'm into it too much. Like, I really want to educate women about how important it is to age well in every aspect, emotional aging, mental aging, everything. So I think that's my next.
It's a wonderful topic you're bringing up, and I really am so grateful that you just put an emotional aging in there, because we do talk longevity is biohacking. Longevity, it is like the topic everywhere, which I think is it's fantastic and very important, right? You need to take this supplement, or you need to not do that, or the micro dosing that we were talking about, also like whatever it is that you're doing. But then there's the emotional component. I have to say, I see people's emotions are actually more like built up resentment, frustration, grief, anger, sadness. You see that, and it really does affect so much your aging, both the organs aging, but also your skin, your biggest organ. Like you will see it on the face, no matter how much you're doing to help that. For example, in sculpting or in fillers or whatever it might be doing, Botox, whatever it is, if you're hurting yourself from the inside, but not just what you're eating, you could be eating super clean, but if you are still holding on to that resentment or that frustration or the sadness, a lot of sadness, you will see it on your face, and it ages you. It ages, not only what is it doing to your other organs, but it's aging that biggest organ. And then when you see on your face, which you're really fighting not to do, you're taking all these longevity pills and everything else, but you're still holding on to that anger and that sadness. I mean, I'm glad you brought that up as a thing, because biohacking does involve that as well. It does involve that as well. Okay, if you think back to your training days, what was one lesson that still stays with you every day in the clinic?
So in my training days, I was really lucky to be trained by a senior who was guiding me really well. That if you can't do anything good, then don't do anything wrong or harm. So when a patient walks into my clinic, my biggest what I have in my mind is that if I was that patient, what would I do? And that's what I advise. So I think that has really helped me to just give the best. And that's what we all really implement. Anything that's done in the clinic is first done on me, and I have to approve of it, and I have to feel that whether it's okay for me, then it's okay for that person out there. So I think that's something which has been really what I've been following.
I think that's what everybody wants, because this is actually a wonderful topic, and I'm really glad again you brought it up, because I think um, dermatology of this kind can have a negative connotation, because you will see some practitioners of it that don't approach it in that way. So they're approaching it in, somebody comes in and they want a certain look for their face, or they want a certain treatment, and then that practitioner will just go and do it without actually consulting. No, that's really not best for your skin. Maybe you're not well enough. Your diet, your lifestyle, whatever it is, isn't there. So it's not going to give you the results. It's not a good treatment, whatever. I mean, you can choose the thing, but they just do it because the patient will pay for it. It's wonderful that we're hearing another side of this, right? Which is the less is best concept, which we're going to talk about later, but we'll talk about it now.
So I think we, oh, and me and I myself also, and the brand itself, we follow the less is more concept really very religiously. And it's like I had seen many patients coming to me who were overtreated, undereducated. They don't even know what they're really suffering from, and they're applying all these harsh actives or doing some treatment which might not be the best for them. So at our clinic, we actually make it very simple, and we have a very structured and a personalized plan. And I like to start with less. It's better to build rather than to do too much and then not get the result and just and not have a long term vision. So I think the less is more is what we really follow. And it's just been always great, because I think those are the patients who actually really do well and want to continue the journey with me.
Absolutely, absolutely. And this again is taking in a huge amount of emotional intelligence of this too, because you realize that there is a whole component of this person. Like they may come in looking like this, but you have to give them the right advice, because they may be totally devastated by the way it looks, even though you followed what they said, but that's not the best for them, right? It's a journey, right? This is a beauty journey, if you will. Yeah. Okay, so from the early beginnings, when you built something iconic, let me start asking you about that. So when you built the Bombay Skin Clinic, was there a gap you wanted to fill in the skincare clinic space?
So when I started Bombay Skin Clinic like almost 12 to 15 years back, there were two things, either a clinical setup or a very commercial setup. In the clinical setup, I thought that the approach was very rushed and not very personalized. And in the commercial setup, it was more like a salon based. So what I really wanted was to fill the gap, to make it more personalized, but still medically sound. So I wanted it to be a doctor led place. So For me, my journey was that I was there every day, seeing the patient, guiding them in the right direction, guiding my staff in the right direction, getting advanced technologies, trying to use medicine and science, but also keep in mind that you want it to be personalized and also more less, but still more aesthetically,
Mhm.
yes, inclined, but still medically sound.
Yes.
So I think that was what I really wanted to bridge.
And your clinics have a certain aesthetic, which is beautiful. So minimal, calming, intentional. I love the word intentional here because intention is everything, right? So where did that vision come from?
So, what I really think is that the outside world is so loud, emotionally, sound wise, physically, everywhere. So, when I see that patient walk into my clinic, I want them to suddenly come and feel very calm, very relaxed, very minimalistic. Everything is really white and clean. Clean designs, very minimalistic. So when they enter the clinic, they already have this feeling that this place is there to take care of us. And I have had many patients even tell me the same. And I think they understand from looking at the clinic that they are going to be sorted out more in a lesser way and more in a aesthetically sound but still medically sound way. And I think that was the vision of actually design making this brand very simple and very minimal.
Yeah, and it speaks totally to the mission, right? It also speaks totally to who you are as well, because yes, okay, you're the medical doctor, but the emotional part of it, right? You are feeling what your patient would want to feel. You're giving them a journey, also an experience, because the outside world is exactly like what you said. It's so overstimulated. In that space, you want people to feel probably the trust because it feels like a reputable place and it feels like a not a clinic like cold, but a clinic, like a medical clinic because that's what it is, but at the same time peace and calm. So it's really important. That's wonderful that you were able to do that, and I think the intention is so important. What's one misconception about premium skin clinics that you wish more people understood?
So I think what people when they hear the word premium, they I think mean that they're going to give too much of advice and unnecessary advice and expensive. For me, premium skin clinic means that it's going to be advanced, it's going to be medically sound, it's going to have a lot of latest technologies, it's going to have well trained technicians, it's going to have products which are going to be used are going to be very highly advanced. And sometimes for me, premium skincare also means that when I have sometimes a patient walk in, I just tell them you don't need anything, go back. This is the routine that you need to follow. I think that's what is also sometimes just nothing is what is, I think.
Absolutely. So when they come into a premium clinic, or at least in your clinic, for example, they're going to be getting it's an experience part. It's not necessarily the pricing, it's not necessarily the overdoing of everything. And also they can trust it. I think that's the most important thing. I When I hear premium, it's like I can trust it. I don't have to overthink, over research, over whatever else. I can actually trust that it's sound. I'm going to get the right service and exactly what I'm getting, and I'm actually going to get the right advice from an empathetic person, which is really important. Okay, so we're going to go back into that less is more concept now. So, minimalism in aesthetics, that's rare, as we mentioned before. When did you realize that this philosophy was going to guide your entire practice?
So that's what I'm saying. When I started practicing, I saw a lot of patients walking into my clinic being really over injected, over treated with a lot of, superficial treatments, which were actually damaging their skin barrier and also making them more confused at what they want. So I started believing in this philosophy and in doing it on myself too, is less. Everything has to look really natural. Everything has to be about healing your skin from inside, building a stronger barrier, having consistent plan, not very fast acting results. So I think when I have patients who walk in, they're first given a program which helps to build their skin, make it stronger. Only then we do treatments. So build the skin foundation, then treat the problem. So I think that is what led us to this minimalism concept. When I started seeing patients are confused, patients want less themselves, and you yourself would do less. So why do more?
Yeah, absolutely. And I think, I mean, the amazing part about that too is that if you're talking about being adoption of these it's a lifestyle change, right? So you're talking about lifestyle changes when it comes to like nutrition, because that's how you're going to get a good barrier, or the way in which you use certain skincare. It's not just you're going to inject something and then finish. Like that's it, Hollis. You have to actually build up to it. You have to create. It's a lifestyle shift, if you will. Like it needs to be sustainable, right? If it's not sustainable, then they won't continue with it and it won't work, right? No matter what you do, it won't work. So that's a great thing as well. All right, let's talk about Korean skincare because this is everywhere, right? And I would love to hear this perspective from India perspective as well, because this is very important. So K beauty is all about multi-step routines and trends, while your approach is minimalist. Okay, so we're kind of on two different sides of it here. What's your honest take on Korean beauty and how much of it actually makes sense for Indian skin?
I think K Beauty just did a fabulous job for us where they made everyone so aware of skincare products and fall in love with a skincare routine. I think before that, people were not even aware that there's something called as a skincare routine. So that really got it done simple for us. And when I attended a conference in Korea Derma, and I was floored and amazed at how important over there they were talking about hydration, skin barrier, good skin health, good internal health, everything. The only, I think, the K beauty concept of the 12 step or 10-step routine doesn't fit into our climate, doesn't fit into our skin type. So I think it's a mix and match of both. So you really need to pick up the best part, that is they work a lot on hydration and barrier system, and that can be achieved even with a 3 to 4 steps. You don't have to follow the 10 to 12 steps. So I think using that, use your 3 to 4 steps, which are perfect for an Indian skin type, the weather, the melanin content, and it can do a fab job.
Fantastic. So just adjust it,
So
right? So it's
yes,
never one. It's not one size fits all, right? It never
exactly.
it is.
It is.
But there, I do agree. Like the awareness. I mean, awareness is huge,
It
right?
was
So
huge.
even with emotional intelligence, also with medicine, it's
Yeah,
like the awareness of what's going on and what you could do. So the
yeah,
awareness of skincare
yeah,
and a skincare routine
yeah.
is huge. So that I
I think
agree.
it just got really viral,
Yeah, it did.
and
It
yeah,
did.
it
It
was
really did.
amazing.
Yes. But I would agree with you. The 10 to 12 steps, I'm like, after I get past the number 4, I'm like, and you've lost me. I can't. Like
Yeah,
it's, and then I get confused as to which one I'm supposed to be doing first, or like
exactly.
when I'm supposed to be doing it, nighttime, morning, like how often. I'm like, they're too much. That's too complicated for me. Also, I travel too much. I can't
Exactly.
have, I could not possibly have, as much as I love it,
Yeah.
I cannot possibly have an entire suitcase with all my skincare in it.
It's
Like
not possible.
it's not
It's not
possible.
possible for anyone to sustain it.
No, it's
Like,
not.
it's
It's
not.
not. I definitely agree with that. Okay. How do you handle patients who walk in wanting big changes when you know subtlety would give them better results?
Hmm.
Yes.
I have them coming all the time.
Yes, I'm sure. I'm sure.
I think people do want the dramatic change, but I think my job as their doctor is to advise them that if you go for subtle changes, that's actually novelty. That's going to make you look, more aesthetically sound and more, beautiful over the period of time.
Mhm.
Educate them that doing, you will still look yourself, but you will just look better.
Mhm.
Like you will transform better if you do subtle changes and do it
Yes.
over a period of time.
Yes.
And what I've realized is that patients really value your suggestion and they will really go for what you advise them.
Right.
It's just about giving that extra time, sitting with them, explaining them, and they're actually really, really happy to listen.
Yes.
At least my patients are. So,
Yes.
I think it's the way you put it forward and how honestly you put it forward.
Mhm.
And I think they're really there. I think patients do a really fab job in that.
This is one of our Success Decoded here. It's not so much in what you're saying, but how you're saying it so they can hear it, right? I think you're also giving them a different option. So we see something online, which is good, it can be good or bad. You see something online, they think, okay, I want that or I need that. They come in with this mindset and you give them, okay, I acknowledge that that's what you're looking for, but here's an alternative. And let me explain to you how this could work. You give them the information that they need. So that's fantastic also. Okay. Let's move on from skin to something even more emotional, hair. So, hair loss can completely shake someone's confidence, even if everything else is going for them. Their hair starts coming out, patches, etc. What's the first thing you tell someone who walks in panicking?
So when I have someone really with hair loss, and in India, hair loss is huge for men and women. I understand them. I try to really explain to them that hair loss again is a complex phenomena. Stress, overthinking can actually make it worse. But I still empathize with them because that's what they've come in for. And then actually trying to tell them that it's not a problem that is not fixable. It can be treated. It there are a lot of factors that can be treated, like stress, nutrition, any active stressful condition, or any kind of active disease that you've gone through. You will get better. Just be consistent, and you'll get better. And I think that that really gives them that assurance that there is a journey that they're going to take, which is going to make them better. But yes, hair loss is really huge in India, and it does upset people a lot.
What if you were to give one tip to somebody that walks in with hair loss, besides, okay, look at your diet, because definitely, besides look at your emotions and your stress management for sure, because the hormones, the stress hormone and everything, it's terrible for that. But if you had to give them one tip, like what's your number one tip across the board, like not specific cases, for if you're suffering from hair loss, what would you suggest?
Treat it as early as possible.
Okay.
If you are suffering from hair loss, you need to treat it as early as possible. Treat it within 2 weeks, 3 weeks. Don't neglect it.
Yes.
Don't neglect it for months, because when acute hair loss goes into chronic hair loss, then you lose that significant amount of hair.
Okay.
And if you treat it with any active hair serums, as simple as just a hair serum at home, then you can get better, instead of following trends or old trends like oiling can help you, or just using onion can help you. Just false trends. I
Yeah.
think just follow good medical sound advice, and you should fix your hair.
What if somebody came to you and said, "Oh," or what actually better, what happens if somebody's thinking out there, "Oh, but it's, genetic for me or whatever. Oh, like grandmother, everybody, all the women in my family have been like this." What would you say to that?
So, genetic hair loss is a different entity and a condition.
Mhm.
It can also be prevented by lifestyle, by taking the right supplements, by doing the hair serums. It can actually be delayed or by prevented.
Yes.
It definitely cannot be treated 100%, but you are preventing it. So
Yes.
why not try to start it early?
Right. So like don't neglect it, ladies. Like if this is happening to you, don't I guess I've heard so many of my friends where it's like, "Oh, it's just, my mom was like that, my grandmother was like that.
Yeah,
It's just I'm like, "Yes, but if you start seeing it, or even
yeah,
before you start seeing it, if you know you have it like genetic in your
yeah,
family, start using it. Like
yeah.
start come doctor and please like get it treated,
Treat
right?
it
For as
definitely.
early as possible. Like
Yeah,
this is part of preventative medicine. Like
yeah,
I think we think about these aesthetic things
yeah.
as part of like it's not preventative medicine, but it is preventative medicine, because not only are you going to have the aesthetic treated, but the underlying issues are also going to be addressed. And then also the negative emotions that can bring if you're starting to lose your hair loss of confidence, loss of self-worth, and all these other things that come with it, which then you have to deal with afterwards. You can prevent all of that if you
Correct.
just start earlier, right?
Yeah. So in my
So
practice now, with the Gen Zs and the alphas and the chat GPT, they are so well aware, and they're all in preventive zone. And I love that about them. And me being a little bit, I'm more exposed to this kind of crowd. And I feel so glad that, when they come to me, and I have kids who bring their parents to me, they come with them to treat their acne. And when I asked the parent that who's found about me, and they're like, "Oh, my daughter was searching about you, and
yeah,
she was
yeah,
like,
yeah.
I want to treat my acne now."
Yeah,
And I'm like, that is so good.
yeah.
Like,
It is
it's
wonderful.
really,
On the flip side of that, how do you, because we're in the AI stage, right?
yeah.
There's so much information out there, sometimes misinformation.
Yeah.
How do you manage somebody that comes in that's done like basically has self-diagnosed themselves,
Yeah.
and they have like all these different conditions, and you're like, wait, it's actually not that complicated. Maybe part of it, but it's not the whole thing. How do you address that?
So I think you need to, in my practice now, I need to be aware that that person has already read and come. So if I am more aware of that, and if I educate them enough, then they are like, okay, there is some similarity, what she's saying, but there is also some other advice which I wasn't going to get. And there are certain things which I would want to tell them. And then they're like, okay, I think this makes more sense. And I think but to be aware that they know, patients already know, is what I think I'm aware of it now. So I really need to be very sure about what kind of information I'm giving out there.
Right, right.
And I think,
It's like this is why you don't Google your health symptoms and
yeah,
think that you're having that necessarily. Go talk to the experts. Go talk to the doctors, please. Like because that's really it's a very dangerous,
yes,
and it
it's
can
a
be a
thing.
really bad spiral
Yeah.
too. So let's not do that either. This is also for not just other illnesses, but anything that you want to do for aesthetics as well. Okay, there are so many myths around hair fall. Which one do you want to eliminate forever?
Hmm. That, I think myths about hair fall is huge. And I think the two things that I would really want them to like clear this myth is, daily shampooing is bad for your hair. I think that's a really one big myth. I think if you are you're exercising or you are you're sweating a lot, then using a good SLS and an SLS free SLES shampoo can really clean your scalp. So if your scalp health is clean, then your hair quality will be better. And the next one is hair oiling can treat hair fall. So hair oiling is only for conditioning. Hair fall is a complex phenomena. You need proper diagnosis from an expert.
Can you talk to me a little bit? This is not on the chart questions here, but I'm fascinated about this. Talk to me about peptides in your hair. What do you think about peptides for the hair?
So I think that the plant-based peptides are so great for the hair because there are certain micro-inflammation already happening in your hair follicles at a very early age because we are getting into hair grooming so early. Like people are using you're blow drying, they're coloring earlier, and also the older generation also are coloring hair a lot. So there's a lot of inflammation happening, which is a lot of stress to the hair. So, using peptides is a great way to start, not only stop hair fall, but prevent hair fall. And I think they're so safe. And it's like if you can brush twice a day, then you can definitely use peptides
Yeah,
once
yeah,
in the night.
exactly. Yeah, they're
It's like,
great. They're great
it's
for that because
exactly.
they're not sticky and like it's not like
It's not
oils or anything
exactly.
like
The
that.
newer formulations are great.
Yes, yes,
They should become like a part of your routine.
yes,
And I
yes.
think that's really important.
Yeah, absolutely. I swear by them. I absolutely love them. So I think that they're fantastic. I think for your skin and also
Also for the
for
hair.
your hair, for those two things. Okay, people jump to procedures quickly. What are the basic fundamentals of hair care you wish everyone understood first?
So I think before you get into any kind of treatments, like there are a lot of treatments for hair fall, like PRP or stem cells or PRF and GFC. There are so many out there. I think getting the correct diagnosis of your hair fall, like we do a trichoscopy, we do a scalp examination, we do blood tests, we do like so many blood tests, and we fix that problem first. We improve the nutritional part. We really take care of all those things and understand the cause of the hair fall. And then I think adding a correct treatment to your hair loss or the hair fall early is not a problem, but just not to do it as an individual and as an alone treatment. It has to be a combination of both.
Amazing. You need to have a plan.
Yeah,
And you also need a guide to
you
help you with
need
the
a guide
plan.
to
You
help.
need both of those two things. Okay. So now let's look ahead to the future of skincare and your own journey, your future journey. Okay. So where is skincare headed? Are we moving towards high tech or going back to the basics?
Interesting. I think what has happened is a mix of both. High tech in ways where the skin diagnosis and analysis system has become really advanced. It's all AI. You can actually diagnose your skin through an AI device. You can have a professional, you can have a very personalized skincare plan. You can diagnose it through your genetic testing. So that has made it very simple for us. But with this combination, the routines have become more simple. So it's a mix of both. The diagnosis has become really high tech, but the routine and the treatments are still becoming very basic because it's becoming less of clutter. Whatever you need is what you're using. So because of the help of such great devices, we know exactly what we want to treat. So instead of doing many things, we are just doing what is required. So it's really a good amalgam.
It's a balance, which
It's a
is wonderful.
balance.
We always strive for balance. So that's fantastic. Okay. What excites you most about the next phase of your work or clinics?
Hmm. So I think for me, this is huge. Like the next journey that I'm really seeing myself is all of it as a woman in my 40s, as a doctor, as a leader, as an educator, as a student myself. There are two things. One, I really want to continue leading the body sculpting. And second, I really very much want to integrate longevity care in my clinic as a part of everything for all my patients, which I've started to doing it now also. Any patient of any age group, I'm really educating them about more long-term care. So I think these are my two biggest things that I really want to incorporate in my clinic and my next vision.
Amazing. If you could leave people with one timeless skincare principle, something that never goes out of style, what would it be?
Consistency more than intensity. I think that I tell everyone that there is no fast results. Like build it slowly, follow a routine, stick to the routine because in a skincare or a treatment, it takes 4 to 6 weeks for your skin to get used to anything. So there is nothing that can work the next day or in 2 days. It has to be a journey, and a lot of consistent plan can actually help you to achieve better results. So I think that's one thing I really want to tell.
For body sculpting, what is the one procedure that you would recommend? I mean, I know it's specific, right, to what the issue is, but what's your favorite body sculpting technique?
I think body sculpting is a mix of both lifestyle and stubborn fat. What people don't understand is that someone who really has a good lifestyle and still suffers from pocket of stubborn fat, it's difficult to treat. The body sculpting technologies are there to help you to get you, smarter results and faster, but there's not a shortcut. You still have to do your grind, but it just helps you to achieve that result so that you can actually do better, because you, if you see it, you will strive to do better. So I think that's something that I have done for myself, and I think that's really empowering for so many of my patients who feel better, and they come back and they're like, doc, instead of working out 3 times a week, now we work out 7 days a week, and that's really great for me because that's what I was set out to do for them.
So basically, these treatments are even more external motivation for them to make
Exactly.
internal changes,
Yes.
motivation for internal changes or like lifestyle changes.
Lifestyle
So from an
change.
EQ standpoint, we would say that this is helping the motivation. It's like a little bit of a push in the motivation area that will
Yes.
actually then trigger the intrinsic motivation within themselves to make different changes and different choices. So fantastic. So I'd love to talk a little bit more about the effects our emotion can have on our health, right? Specifically, and we're going to hear from the skin part.
Yeah.
Talk to us a little bit about that, because I know that our emotions, and I
Yeah.
say this all the time, that our emotions really affect our organ health, our skin health, etc. So I'd love to talk a little bit more of this for the audience so they can make a connection between the two.
So I think, there's a science behind it, that the gut brain axis or your skin brain axis is all interlinked. So if you are emotionally, less stressed, more happy, it does get linked to your gut health. Gut health in turn gets related to your skin health. So that's why there is a lot of studies going on also on how important it is to maintain your gut health. The gut health, the good bacteria which are present in the gut health are actually related to your brain. So if your brain is more calmer, it sends signals to the gut to have the natural flora remaining in your gut, which actually allows better absorption of all the food, the nutrition part, which actually helps in your skin and hair. So it is all interlinked, and I think that is why it's so important to actually have those good hormones and good uh, good exact amount of dopamine in your body, to just calm you down, but also to keep you motivated.
Right, everything in balance, right? This is why emotional health, and we talk about emotional health being so important, because yes, okay, understanding the emotion is really important, but understanding the science behind that part, which is exactly what you're saying. This is one of the many different ways. But your gut health will never be optimized if you are totally living in cortisol total all the time. There's no balance of serotonin in your system. If your sympathetic nervous system is totally ramped up all the time, then your asympathetic nervous system can't be in balance. It's those kind of things. It's a balance that we're striving for. So it is a holistic system, as we've been talking about through this chat.
Definitely, I think that it's very interlinked, and skin being the largest organ,
Yeah.
I think it impacts the most with emotional, any kind of stress or sadness or fear or anger, or even just any kind of feelings, they definitely reflect on the skin and hair the most.
Yes. Yes. Yes.
100%.
Absolutely. So this is like what we say, I'm really stressed and you get a breakout, for example, or
Exactly.
something of that
Like an
nature.
eczema, it's so
Eczema.
stress related.
Yes,
Like
it is.
it's like, that a person is stressed and you can have an eczema.
Mhm.
Stress is also related to some people in pigmentation, which
Mhm.
so many people, Indian people, are unaware. If they're acutely stressed, someone would break out, but someone would also have a tendency to look darker. So
Mm.
I have some patients saying, doc, when I'm on a holiday, my pigmentation completely vanishes, and when
Mhm.
I come back and I'm stressed and my pigmentation just comes back.
Mhm.
That's how stress can actually trigger your melanin production and actually make the pigmentation become more.
Yeah,
So
amazing. I didn't know that. That's fascinating
yes,
to know. I
that's
know a lot of people just loved learning that as well,
exactly.
for sure. Thank you for
Yeah.
that. Okay, so on that note, let's have some fun.
Okay.
It's rapid fire time. So one skin can, sorry, so you want to answer these questions quickly as you can.
Okay.
Don't overthink it. Okay, these are not
I'll
trick questions.
try.
Okay, one skincare trend you want gone tomorrow.
The 10 to 12 step routine, for sure.
One ingredient you trust completely.
Azelaic acid is like my favorite for Indian skin. It works on everything: active acne, acne marks, pigmentation, dark circles, melasma, everything.
Yeah, I also love it. I also love it as well. A celeb whose skin you love.
I really love how Shania Kapoor believes in the philosophy of how she uses her sunscreen. She really makes sure she removes her actives, takes care of her skin. She's the new Gen Z. They're very minimalistic, but they're very like natural. So I think I really love her, how she looks.
A product you personally cannot live without.
Retinol, I think that's one product I cannot live without, and it's one science based product which actually can transform your skin, not only just for immediate result but also for future skin health.
Overrated skincare step.
I think neglecting your hands. I
Yes.
think a lot of people neglect their hands, so I think taking care of your hands early on will really help in aging process.
Sunscreen, gel, cream, or spray.
My favorite being gel for our Indian skin type.
Yes.
It just really gives you the matte finish, but I think the BB cream I think is more fantastic.
A ritual that keeps your skin calm.
I think improving your skin barrier, like using the right ingredients, ceramide base to help your skin barrier can fix everything.
A rule you wish every 20-year-old followed.
Less, focus on more on doing avoiding use of Instagram trend products and sticking to simple routine.
A rule you wish every 40-year-old would follow.
I think they shouldn't be scared of treatments. A mix of, creams and treatments are really important at the age of 40.
A compliment that truly touches you.
I think any patient who walks in and tells me that, Doc, you changed my life because I'm more confident and I'm more happy is something I really crave for.
One word that defines your approach to beauty.
Natural.
Amazing. Well, thank you so much for being on today. I love this conversation. I've learned so many things. Of course, I have so many more questions to ask, but we could be here for such a long time. Thank you for being here today. Thank you for all the insights you shared. Thank you for the emotions that you shared and also your journey. So thank you. I know you've given us so much today, and I know so many people are so happy to watch this.
Thank you so much. It was so much fun.
Thank you. Dr. Batul, what I love most is how calm, intentional, and honest your approach to beauty is. You make skincare feel realistic, doable, and grounded, not overwhelming. If this episode gave you clarity, comfort, or even a mindset shift, share it with someone who needs simple, real guidance, and follow the show so you never miss an episode. I'm Taylor Elizabeth. See you soon.